Eddie Shelton. I'll be representing the health department. Confirmed cases are 58. Negative cases are 612. Pending,
which is very sad, and we ask for everybody's prayers and support for those families as they deal with this, with these deaths. And our hearts and prayers go out to those families. That's a very sad deal. Out of our tested, we have 256 negative. We have 166 pending test results. Out of that, 107 of those are from the Madison nursing center from yesterday. So out of the 166, 107 of those are out of Madison that we did yesterday. We have 8 persons of suspect in-house right now. That's 8 in the hospital. 1 of those is in CCU, and 7 of those are on 7 Central. And with that, I want to say, while we got everybody on here, Stacy and Dr. Saranovan, we sure do appreciate how we came together yesterday. I want to tell you that phone call that I made over there to y'all, and y'all jumped right on, and we got right in the middle of this. That's what it's all about. And I want to tell ORMC, thank you for partnering and making that easy for us to get that done. Y'all jumped right in there and took care of the the patients, and we took care of the employees. And you could not have scripted that better. And Stacy, for that, thank you very much. And that's how it's supposed to look. And we appreciate what y'all did.
Thank you, Russell. I appreciate that. I have no doubt in my mind that had the situation been reversed, that Medical Center would have stepped up and done the very same thing for us. So I think it's just another example of how united we are together to take care of our community. So but thank you. We appreciate that. An update on the Odessa regional numbers. As of about midday, we've tested 239 patients, still only have 9 positive, 115 are negative. We also have about 115 pending now, of which 98 of those are from the Madison Medical Resort that Russell mentioned in his numbers as well. So that's all that I have. Dr. Saravanan, do you have anything that you wanted to add?
So the only thing that's brand new for today is the governor's announcement at 11:40 this morning, the order that he signed, that's GA 15. That's the order as it relates to healthcare. That part of the order says almost exactly the same as what the March 22nd order said, with one extra exception. So the initial part of the order that says postpone all non-urgent, non-emergent surgeries. Exception 1 says make sure you have enough PPE. And then exception 2, that exception 2 is the only new part of the order. And that basically says a hospital can write a letter to the Department of Health certifying 2 things. One, that we are reserving 25% of the hospital's capacity to take care of COVID-related cases, at least 25% of the hospital's capacity to take care of COVID-related cases. And 2, that we will not ask any state, federal, or local organizations for any PPE for the entire duration of the COVID-19 pandemic. That's the second exception. We are still processing that. This just came out this morning. We don't know if we're ready to do any of that yet. We are still processing, but we are definitely wanting to take care of the community, definitely wanting to get some of those surgeries back in the hospital and start doing them. So we have to just figure out how to do it. I don't think we have an answer yet for that, but we are processing for now. That's all I wanted to add for now.
Yeah, and I wanted to throw it to Dr. Davenport as well. It seems like, you know, some good news for hospitals in the elective surgery front, but as Dr. Saravanan alluded to, it's not just we're going to open this up and everything's going to start getting back to normal again. There's a lot you can shut down, of course, within a day, but to restart these possible procedures again is going to take some time if you do choose to meet one of those exceptions.
Yeah, it's a big deal because we do need to get back treating patients for other problems. I mean, those are just going to continue to build up, build up, build up. And eventually, some of these elective procedures become more urgent when they are visiting your emergency department or get admitted to the hospital. So we do have to start acting on some of those issues as well. One of the ideas that also came out is recognition, and I'll echo what Dr. Saravanan said, recognition of where we are from a community standpoint with regards to who we're treating. In Ector County, our numbers keep going up. Okay, so we have not met our apex yet. You know, on a weekly basis, we're still seeing climb. And so if we haven't reached the apex of what we're seeing, we're going to have to be very cautious as to how we move forward. We certainly can't introduce this into a hospital setting. And so then you're trying to decide how you're going to use your PPE versus how you're going to test individuals coming in for elective. And so there's a very fine line with regards to the utilization of those two issues, so you don't deplete what you have.
I thank you, Dr. Davenport. I think that was kind of important information both you and Dr. Saravanan shared that is kind of hard to digest right now since he just came out with that about 3 hours ago. So still a lot for the hospitals to think about and digest before participating and opening up some of these elective surgeries, which we agree that both hospitals desperately would like to start, but only under the right circumstances. So with that being said, let's start with some of the media questions. Looks like we've got Andrea from CBS 7. Andrea, you want to ask a few questions?
Yeah, thanks, Trevor. About the rapid testing kits that we are about to receive, I was wondering if you could give us any numbers on how many are going to go to the hospitals here in Ector County, and how are they going to be used?
Yeah, go ahead, Doc.
Okay, so I was going to just say that the machine is already here, but the testing kits is the limited in number. The manufacturer is making the testing kits. We're talking about the Abbott machine. That's the 5-minute tests, positive, and 13 minutes for the negative that I was explaining yesterday as well. So that machine is here, but the testing kits, even though the manufacturer is making them, they are not allowed to sell them to anybody else. They're only allowed to give them to the state, and the state decides where those testing kits are going. Couple of weeks ago when this first came out, there was 50,000 of those testing kits that were for the US that were distributed to certain states. I don't know any new numbers since then of how many more have been manufactured. I assume there's been a lot more. As of right now, we are being told we'll get 2 testing kits. Each kit can run 24 tests. That means we'll get 48 tests. I don't know when we'll get them, but that's what we're being told that we'll get for now. So if and when we get them, the people that we should be using it for, we should use the CDC's priorities, which we've gone over before. The priority 1 being the healthcare workers and the hospitalized patients, priority 2 being the high-risk patients, priority 3 being all the other essential care workers. So we'd follow those CDC guidelines to use those tests. People that need to get back in the workforce right away, they'd be in the priority 3 essential workers. We would use the rapid test for if we could.
And I think our numbers are about the same. Kristen, do you know anything different than that? I think that's pretty much the same.
It
here.
is. Our numbers are going to be about the same as ORMC's numbers.
Thank you.
Anything else, Andrea?
With regards to the drive-through testing facility that could be coming soon, do we have any kind of plan for how that's going to work?
So that's coming from the health department, and the plan is being worked on as we speak. So I can't comment on it just yet. I just assume wait till we get the plan in place before I make any comments on it.
Cool. And I just have one more question. The EOC, is that Facebook page that was set up back whenever the EOC was set up, is that going to still be active? Do we need to look to that for more updates?
I know that the health department's Facebook page is active. I'm not sure on the EOC, but I would probably refer everything to the health department's Facebook page.
Thank you. That clears that up.
Any more, Andrea?
No, I'm good. Thank you.
All right. Looks like we got Danny next. Looks like he's still connecting the audio. Danny, can you hear us? It doesn't look like Danny can hear us. Next is Mike Merlot from Odessa American.
Hi, I guess this would be for the county. Is there any local doctor's office where a lot of person-to-person contact has occurred? Do we know anything about that, Mr. Shelton?
I'm not aware of anything, but I can ask and find out.
Okay. And can you tell me if the 30-year-old woman who had passed away in Odessa, was she a healthcare worker?
I don't have that information.
Okay. And is there any update on when we could get that cluster map?
Okay, you need an update on the cluster map, 30-year-old healthcare worker. What's your other question?
What was that, sir? You kind of.
What was your other question? I'm going to find out on the 30-year-old whether that was a healthcare worker. I'm going to see when the cluster maps are going to be available. And what was your other question?
Yeah. Let's see here. I think those emails the county sent out today were, pretty appreciative. Is that something we can look forward to?
Appreciated it.
Are those emails, are we going to get daily emails like that from the county like we did today? Is that something that we can look forward to?
I will try and make that happen for you, Mike.
Okay. Let's see here. And let's see. Abbott said that by late, Governor Abbott said by late April or early May, there will be enough tests to test entire communities regardless of symptoms. Is that something county officials and hospital officials see coming? Is that something that we can see in the future?
Go ahead. Sorry, Eddie, go ahead.
I mean, I can't see in the future. We would certainly like to have the sample kits as many as we can to test everybody we can. We'll just have to wait and see how he provides those.
I'll tell you from MCH standpoint, man, we want all the testing kits we can get out there. Sometimes those come pretty easily, but as you can see, just like we talked about earlier with the rapid kits, you get 4 kits in this whole county, so you're going to have 48 tests in this whole county. There's challenges there to get enough to be able to test every community. So, but as they come in, we'll take them. But we're going to be interested to see how those flow into Ector County.
Right. So we don't really know how those cartridges or the different equipment will come in, so we can do those kinds of tests.
No, sir, we do not.
No, we have no indication right now, Michael. And the rapid tests, I think, will be a big game changer as well. Because if you think about it, now in the hospital, we have a PUI unit, a person under investigation unit, and a COVID unit for the patients that have COVID-19 disease. If you get the rapid test, you can close your PUI unit because there's no more persons under investigation anymore, because the tests are going to be back in 5 minutes. So you know whether you have it or not right away. So we'd be able to close one of those units. That'll decrease resource utilization as well. So it will be a game changer when it does get here. So we're hoping, like Russell said, get us as many tests as you can.
We'll use them.
Okay. And for Mr. Shelton, I was watching the county commissioners meeting today, and I saw that county judge, Debbie Hayes, mentioned scaling down the EOC a little bit. What does that look like?
Well, they're going more virtual, so they're going to scale down the physical presence in the local facility, and they're going to go more virtual in their contact tracing and investigations.
Okay. So it doesn't have to do with the workload. It's more about where the work is done.
Yes.
Okay.
I did get confirmation that that 30-year-old woman was a healthcare worker.
Okay, and do you know where she worked at?
Well, I didn't ask that question.
Thank you. Let's see here. This could be for the hospitals. What does treatment for the 4-month patient look like?
I'll kick that on our side to Davenport.
Okay.
So can you ask that question again?
Yes, sir. We got an email from the county that there was a 4-month patient,
4-month of age.
Yeah.
Yeah. Sure.
And I was just wondering what that kind of treatment looks like for that patient.
Well, I think ultimately it comes down to other patients. In medicine, we talk about treating pediatric patients as pediatrics and adults as adults, but in a lot of symptomatology and such, we're going to treat them the same. If that child is having no issues with the respiration, still running fever, cough, and we have the capability of treating them at home, we put them in quarantine just like any others, recognizing that a parent will probably need to be more readily available and possibly supplying some PPE to prevent that parent from being contaminated with the virus. If that child then should develop symptoms that require hospitalization, we're going to have to stratify our risk factors, or stratify those risk factors to decide where we can take care of that individual. Here in Odessa, we really don't have the capability of an ICU to take care of pediatric patients. So if we are suspicious that that patient could get sicker or should get sicker, most likely we send them up to Lubbock to be treated initially, rather than run the risk of having a complicated course in the hospital and having to make another transfer to a pediatric facility.
Okay. And what are things parents should look out for if they got a child that young? What are some symptoms that you would see in a kid who's 4 months of age?
4 months, it's probably a little more difficult because they're not able to probably give a good history to their parents about how they're feeling. And so it's going to be more of watching that child for problems with respiratory distress or worsening of a cough, higher fevers, lethargy, or not acting right, if that's what the parents are identifying, how they're interacting with a parent. Those may be some of the things that they're going to want to watch for.
Okay. And Mr. Shelton, do we know if that was a person-to-person contact or if that patient was a boy or a girl?
Well, the 4-month-old was living with the grandparent, and the grandparent had tested positive. So the children were tested, and this child did test positive. I'm not aware if it's male or female.
Okay, thanks. And on the county website, I noticed that there are some younger folks who look to have tested positive, children. Was that a family, and what can you say about that?
So it is a family. 3 out of the 4 children in the family, the 4-month-old being one of them, tested positive, along with the grandmother.
Okay.
They discovered this through the contact tracing and investigation. That's how they discovered that the 4-month-old also had it.
Okay. All right. And I guess my last question would just be, where are members of the EOC today? Brandy or Dale, why aren't they joining us today?
I'll be your representative
From now on?
from now on.
Okay. Thank you, sir. That's all I have.
All right. Krista, did you want to clarify a little more on the pediatric case? Because we have had a pediatric PUI come in. They were obviously negative, but we have dealt with a few children that have come in that we suspect that were negative.
We do, and our pediatric department is set up to care for those PUI patients. We also have a direct relationship with Covenant where they have a hospitalist in-house with us. He is here, or they are here 24/7. And when they're not in our building, they have a response time of 30 minutes. However, the bulk of them now are staying here on campus. So we have a telemed unit set up with Covenant so that any of those pediatric patients that come, as they progress in their respiratory issues, we have them to consult with, and we have a direct bed placement for them at Covenant in the event that we were to need it. However, we are set up currently within our pediatric unit to care for those people, as well as move them up to an intermediate level where they have telemetry monitoring on their hearts, those types of things. And then if we need to progress to transfer, we have that.
Okay. Dr. Saravan, did you want to address that as well? You guys' pediatric unit is now the designated COVID floor, correct?
Correct. Yeah, we currently don't have a pediatric service active. We closed it down so we could convert that space to use for COVID-related care. With regard to the questions for treatment for pediatrics, Michael, you were asking, there are certain drugs that you can give for pediatrics. Obviously, the doses are a little bit different, and there's protocols on how to treat those. But supportive care is what has shown that it'll show the most amount of improvement in kids. Like Dr. Davenport was mentioning, for pediatrics, it really depends on which system gets affected. So far, the peds population hasn't seen as severe a disease like the adult population has seen. So we hope it stays that way. But if it does come up, then again, we would send it to the pediatric specialty hospitals that we have relationships with, like Kristen was mentioning.
Hey, Mike, you got anything else?
One more for Eddie. Did you get any answers back from some of the questions that I had?
You will be getting daily emails. The little 4-month-old is a boy.
Okay, thank you.
Yeah.
So we'll
right.
get emails with some of those other answers as well.
I didn't see the email, yes, and I will look at the email and make sure that you can get everything you got.
Thank you.
All right, looks like we got Marcos. You there? You have any questions?
Yeah, just one for Eddie. Is there any reason the 4-month-old isn't on the website yet?
I'm sorry, ask that question again.
Is there any reason the 4-month-old isn't on the website yet? It hasn't been updated with the 4-month-old, I've noticed.
On which website are you referring?
The county health department.
I'll look into that.
Marcos, have anything else?
That was it. Thank you.
Okay. And then channel 2, I don't think they're there. It looks like Danny, we'll go back to you. Danny, you have any questions?
No, I'm good right now. Thank you.
Okay. I got a couple questions from some comments I just want to ask real quick before we reconvene for the weekend. First one was, this might have been addressed earlier this week, but there's been a lot of talk on those rapid tests and still waiting. Do we know how accurate those rapid tests are based on previous cities and counties that may have already been partaking in those rapid tests?
I can give you a little bit of an answer on that. The sensitivity and specificity of those tests is not fully determined yet, but it's not any different than the PCR that we were sending out to the labs. So it should be as accurate as the tests that were going out to the labs.
Okay. Dr. Davenport, did you want to add something as well?
Nah, that's good.
Okay. Another one was, I believe one of you guys mentioned that we're still seeing, Dr. Davenport, I believe, had mentioned that we're still seeing an increase of cases, that we don't think we've reached the peak here in the West Texas Permian Basin region. One question was, do we keep thinking, do we think that we are overshooting where that peak will be, that we are being maybe too proactive in overestimating where those peak, or are we still just basing that on what we can, past research and models is all we have to go on right now?
I think for ourselves, we have our own models that we'll follow. We're fairly isolated here in West Texas. We've done well social distancing from one another, and so I think that's kept that peak down. But as we've introduced the virus into the community, and we can even look at the long-term care clinics or the nursing homes, we may see a rapid rise with regards to that. It's kind of hard to say. With our testing, we're certainly identifying those that are asymptomatic. And so I think we still have to keep the course of despite wanting to move back into more normalcy, we still need to recognize we need to social distance. We still need to monitor ourselves for signs and symptoms. We still need to have adequate testing. That's not going away anytime soon. So despite wanting to get back to normal, we're not quite there yet.
Okay. And one other question I had saw, this might be for the doctors as well. This is more of a clinical one. I guess they had read something in a recent article regarding treatment for high altitude pulmonary edema, I guess called HAPE. They've been seeing that there's some possible good news out of similar treatments. Have either of the doctors heard anything regarding that?
Sure, I can take that. High altitude trauma to the lungs also decreases the surface area where air exchange can happen. So I had explained the disease process of COVID previously, is that it destroys some of the lung cells and it puts fluid in these regions of the lung called alveoli, which is where air exchange between the atmospheric air and the oxygen within the blood happens. So if you decrease that area available for air exchange, you don't get enough oxygen into your blood. These treatments are working on those kind of treatment options to increase the amount of air exchange, perhaps using things like nitrous oxide to be able to push in more of that oxygen into the blood. We are already doing that with our critical care patients. So we are using some of those, not in the same way with hyperbaric chambers and things like that, but we're doing that with the ICU patients that are intubated. So that's a good thought. It's a good for scientific discussion, but there's no good protocols yet to fully utilize that kind of treatment options for COVID cases.
Thank you, Dr. Saravanan. And that was all I had. Any other questions before we go for the weekend and reconvene on Monday? All right. Well,
the County Health Department is updating the website right now. It does have the case numbers and they're just filling in the data.
Thank you, Eddie.
All right. Thank you, guys. Have a good weekend, everyone. We'll see you back here on Monday.
Thank you.